If you are currently caring for a pregnant cat, or think you may do in the future, you should watch our Caring for a Pregnant Cat video first, as this will give you some tips on how you can support your cat through her pregnancy. This video will explain about the 3 stages cats go through when they give birth, so you can be prepared for when this happens. Nearer the time of the birth, you may notice signs of your cat nesting, where she will choose a quiet place to sit and start to paw at and arrange blankets for a birthing area. If you start to witness this, it is best to watch the cat quietly from a distance, taking care not to disturb her or make her anxious. Cats are generally very good at just getting on with giving birth, so you should not intervene unless absolutely necessary and under guidance from a veterinary professional. The birthing process can also be referred to as parturition or kittening and occurs in 3 stages. The first stage of kittening sees the queen become restless and perhaps repeatedly visiting her bed or nesting area. There are intermittent contractions but no straining. This can last up to 36 hours, but is usually shorter for queens who have given birth before. Stage 2 is when the kittens start to appear. The queen will visibly start to strain and the kittens' heads will be seen first. Once each kitten has been born, the queen will chew through the umbilical cord and start to lick the kitten. This cleans and encourages the newborn to start breathing. Stage 2 can last 5 to 30 minutes for each kitten. Stage 3 is the passing of the placenta, or afterbirth. You should try and ensure that placenta is passed for each kitten. However, it's important to know that the queen's natural instinct will be to eat the placenta in order to hide evidence of the birth and protect her offspring. You should therefore be as attentive as possible from a safe distance. And importantly, do not try to intervene unless absolutely necessary. If you believe all placentae have not been passed within 4 to 6 hours after the last kitten is born, you should seek advice from your vet. The time between the delivery of each kitten is usually 10 to 60 minutes, and stage 2 and 3 will be repeated each time. The whole litter will usually be born within 6 hours of the first kitten being born, but can last up to 12 hours. Between 1 and 9 kittens will be born in a litter, but most commonly 4 to 6. When the birth is finished, the mother will settle and allow the kittens to feed. After the birth, you should ensure that the queen has food, water and litter tray nearby for easy access. However, you must be careful that there is no risk of the kittens becoming trapped or drowning in a water bowl. It is therefore a good idea to elevate food and water bowls for the queen and to prevent the kittens from climbing into them. Cats are generally very good at managing births without any intervention. However, occasionally things can go wrong. Cats Protection advises that as soon as your cat goes into labour, you call your vet to make them aware you may be in contact if any issues arise. You should call the vet for advice during the birth if, during stage 1, the queen is panting and returning to the bedded area frequently, and this is lasting longer than 24 hours without any sign of straining. If the cat has been straining for more than 30 minutes without producing anything, as this could indicate an obstruction. If there is excessive bloody discharge. If a kitten is stuck halfway out and cannot be delivered. Or if the queen does not bite through the umbilical cord, as you may need to cut this manually. If possible, try not to approach the queen or newborns after the birth, as there is a risk you will disturb the natural bonding that needs to occur between mum and kittens. If this happens, there is a chance the queen will reject the kittens, or even worse, may kill them. Newborn kittens can lose warmth very quickly, particularly if the mother is avoiding them. You can provide them with warmth yourself with a well-covered, warm hot water bottle or heat pad, no hotter than body temperature. The kittens should also be covered with a lightweight towel or blanket. Keep the room temperature warm and the bedding clean and dry. Newborn kittens should start to suckle from their mother almost immediately after being born. It is essential they receive this colostrum, which is the first secretion from mum's teats, as it contains antibodies to boost their immune system. For this reason, newborn kittens must be fed within 2 hours of being born and cannot go more than a couple of hours without milk. If they haven't started to suckle after half an hour, gently guide them towards the teats. If any of the kittens don't start feeding, consult your vet as soon as possible. You may need to start giving a substitute milk replacement to the kitten by hand. For more information on hand rearing kittens, please visit our website. The Queen should also be carefully monitored after the birth. If there are any problems such as discharge from the genital area, prolapsed womb, or any kind of erratic or disturbed behaviour, you should seek veterinary advice as soon as possible. For more information, please visit our website.